Hi everyone, so this is going to be a supplemental video to the discussion of Gulf War illness. I want to just briefly discuss how we compare as a country internationally. So the first Gulf War was mainly an American effort, but there was other countries involved in it. And some of the notable countries include the UK, there is France, there's Germany, Poland, so Canada, of course. So these countries have sent soldiers, but they sent soldiers in much smaller quantities compared to the U.S. And they don't really have a really number of soldiers that came back with Gulf War illness list, and so it is really difficult to draw conclusions here, by just looking at the Gulf War illness condition. However, we can actually look at a report from the Canadian government that compares the healthcare for veterans across four countries, so Canada, Australia, UK, and the US. And you may be surprised to hear that the VA system in the US is actually the one that fared the best among all four in terms of healthcare coverage. And the Canadian government, who commissioned the report, actually points out that while the U.S. has the lowest healthcare coverage for civilians, it has the highest healthcare coverage for veterans. So this is something that's very positive for us. But it also points to a need to improve the veteran healthcare system of other countries, considering the problems we discussed with the VA already. However, these countries do offer some additional services like financial counseling for soldiers who have gotten compensation for their injuries. So this is something that the U.S. could improve. We should also look at the area of suicide, veteran suicide. So this is, again, an international problem. It's not just restricted to the U.S. It turns out that both Sweden and German militaries have, among soldiers who have deployed abroad, of course, have experienced higher than average suicide rates. So this indicates that, and again, these are countries that have prospering healthcare systems, so they are not really wanting for resources. There is a global phenomenon where the mental health of veterans is not really supported, and this has, in some cases, translated to suicides. So this is something that needs to be addressed in order to assure that veterans can have prospering lives after their military career. So thank you so much for listening, and I will be releasing the fourth video about more theoretical stuff soon.